Good morning, everyone. Thank you so much for joining. We'll go ahead and get started now as people are trickling in the interest of time. Thank you so much for joining us today for the Clinical Climate Change Conference and our workshop. This workshop is going to be about public health data tools used for surveillance and tracking. And we're hoping to get you using the database today very hands-on and learn how you could, access, use, and apply this data to your work. And so I'm Lauren Zajac. I'm a pediatrician here at Mount Sinai in the Department of Environmental Medicine and Public Health. And I have two co-presenters today, Dr. Erin Thanik.
Hello, everyone. I'm Dr. Erin Thanik. I'm a physician in the Department of Environmental Medicine and Public Health at Mount Sinai.
And Grant Pezeshki.
Hi, everyone. I forgot to unmute. I'm a technical project lead of the Environment and Health Data Portal. And so I work at the New York City Department of Health and have for many years working with data.
Okay, so we do not have any conflicts to disclose. And getting started. So today's learning objectives, we are going to walk you through two really great, useful public health surveillance tools. And also along the way, hope to provide some resources and tips of how you could integrate this into your work. So in a very broad sense, public health surveillance or tracking is an ongoing systematic collection of an analysis and interpretation of health-related data. And so today we're going to focus on two environmental health tools, and we're going to use case examples that are related to climate change and health. And what's really great about these data sources is they can be used by diverse stakeholders. And myself, I wear many different hats, and I've been able to use this data as a clinician, as a teacher, as a researcher, and for advocacy. And this public health data, and I'm going to go through a couple of case examples, data shouldn't exist in a vacuum. We need data for action. And so this data can be applied in many different ways. And you see here something called the Heat Vulnerability Index for New York City. And during Grant's session, he's going to walk you through this very useful New York City Department of Health database. Next slide. Okay, so one example is, this Heat Vulnerability Index created by the DOH and Columbia University. This data, which really shows by community the risk of heat-related morbidity and mortality based on social and physical characteristics of the neighborhood. And using this data, it directly informed a public health program called Cool Neighborhoods NYC. And so by using this data and targeting the communities that are at highest risk for heat-related illness, they were able to implement programs like shade planting, this picture in the middle here, painting the roofs white, cool roofs, Be a Buddy program, which is a social cohesion program that's community-led to ensure that the most vulnerable citizens are taken care of during natural disasters, heat waves, etc. And this is just another way that this heat and climate change related data can be accessed and evaluated, and Grant will go over that in a few moments. Another example of how data can be used for action. So we just talked about a program. This is how data was used to change policy. And so this is a photograph of someone installing a air quality monitor in New York City. And so the city has something called the Community Air Survey. There's about 100 sites around the city that monitor for key outdoor air pollutants that have an impact on public health. And so this data was directly cited and used to support and then enact a policy in New York City that has to do with the burning of fuel oil. So those of you that live in the city, this photograph here is a familiar sight. So many residential buildings are heated with boilers that burn fuel oil. And the photo on the right side with the 3 different vials of oil show the different grades of oil that can be used. So number 6 oil is really thick and sticky, and it's very dirty when it burns. It creates a lot of that pollution and contributes a lot to particulate matter levels. And so this community air survey data showed that the strongest predictor in the city of particulate matter and sulfur dioxide, because sulfur can be a part of the fuel that's burned. And so particulate matter and sulfur dioxide levels were related to the density of buildings that are burning the fuel. And so this data informed, well, we need to do something about this because we know that the health effects of these air pollutants. And so back in 2010, City Council passed a law that implemented a phase out of this number 6 oil, transition to by 2030, buildings will have to be number 2, all have number 2 oil. There are some buildings now in the phase-in period that went from 6 to 4 with the ultimate goal of 2, which is the cleanest burning oil by 2030. And so this is, showing for sulfur dioxide how the levels changed over time as this policy was implemented. So data-informed action. And next slide. Oops. I didn't realize there was animation, sorry. So that's an example of how data-informed policy action. And something else I wanted to mention is that, again, this data is meant to be used and an important part of data is thinking about all those diverse stakeholders and what data is important to them and what we could do with the data. And I'm very fortunate to work with and learn from our community engagement core here, specifically Lou Squell, who runs a community science initiative. So community science is really truly engaging with stakeholder communities to both direct research questions, collect and analyze data. And so with environmental health, we have a transdisciplinary center here at Mount Sinai, and our community engagement core has really focused on not having data and research in the vacuum, but really using the community science framework to inform action. Next slide. So Luce and the community science team, they use both existing public health tracking tools, which you will learn about in a few minutes, as well as community science kind of crowdsourced data collection on environmental health issues. And so this is just an example of some of the technologies that they've used to collect data in communities. And a lot of these projects have involved very diverse groups from middle school and high school students on up to various community leaders. Next slide. and a case study that highlights the potential impact of community science. This is such a great example. So the Community Engagement Corps in Rutgers, New Jersey, they were approached by a community group who were concerned that the diesel trucks would, to skip a toll on the New Jersey Turnpike, they would go off the highway and travel down the middle of a very residential area, homes, schools, child care centers, and there was a lot of truck traffic. And so this group partnered with the community group, and they collected data on truck counts, on air quality, and presented that data to the city council. And that directly led to an ordinance that prohibited trucks from taking that route through the community. So that data directly informed action, which had very tangible benefits for the community. So now I'm really excited to turn it over to my colleagues who are going to walk you through two databases, which we hope you'll be able to use for many purposes in your work. So first, Dr. Thanik is going to start with a national database from the CDC.
All right. Thank you, Lauren. And thanks for outlining the importance of having access to environmental tracking data. And now Grant and I will walk you through how to use two different publicly available web-based platforms that integrate both environmental and health data. So I'm going to be discussing the CDC's Environmental Public Health Tracking Network first, and I'll give a brief background, and then we'll walk through the steps of how you can actually access the data. So the CDC developed the National Environmental Public Health Tracking Network in 2009 to help fill a gap in the field of environmental science. And they did this by integrating both health and environmental data from across the country, and they house it in one place. And so they achieved this by funding 25 states and one local health department. And then all of the local tracking networks feed their data back into the national tracking network. And the New York City Department of Health is actually the only local health department in the country that's part of the tracking network. And Grant will be reviewing their program later in the talk. So it can be difficult to study the effects of environmental exposures on health because we're exposed to several different environmental factors at once, but when people study them, they often study only one or a few environmental hazards at a time. And the tracking network is a way to integrate both health and environmental factors, as well as some population characteristics, such as some demographic variables from several different sources, and then present them in one place. And as I mentioned, all the data is publicly available, and the ultimate goal is to transform data into action. And as Lauren has discussed, this initiative can be used to inform public policy and initiatives. So the Data Explorer is a web-based tool where you can access all of the CDC's environmental tracking data, and we're going to learn how to use this tool. I'm going to walk you through how to use the tracking tool. I think we'll put the link in the chat so you have access to the link. And then I'll walk us through this first scenario and highlight the different features of the Data Explorer, and then I'll go into the platform and we can go through another scenario together. But for this first example, we're going to look at projected heat events across the US for this year, and then we'll compare it to projections 63 years from now to see how climate change will affect the number of extreme heat days across the country. So when you access the Data Explorer tool, this is the page you're going to see. This is what the home page looks like. And there are 5 steps you need to complete before you can view the data. And for the first example, we're first going to look at current projections of heat across the country for this year. So for the first step, you want to select the content area you're interested in. We're going to choose climate change. And then you want to select an indicator or specific characteristic. And for this scenario, we're choosing future projections of extreme heat. And then you want to select a measure, which is you're getting more specific, and we're going to choose future projections of extreme heat during the daytime. Step 2 is to pick the geographic level you're interested in, and options you can choose will vary depending on the availability of data. You can pick between national, state, and sometimes you have the option of choosing a more narrow geographic area, such as census tract data. For our scenario, we're going to be looking at national data, so we want to choose all counties which are available. And step 4, you want to choose the time period that you're interested in and that you want to focus on. And we're going to choose this year, 2021. Step 5 is where you can choose advanced options here, only if available. These advanced options are not always available, but you can sometimes stratify by various demographic variables, such as race, ethnicity, and age. But in our scenario, we will stratify by low emission estimates, and absolute temperature threshold will pick 90 degrees. So then to view the data, you click on the green Go icon that's located in the lower right. And then once you do that, this is the screen you'll initially see. The data are first displayed as a map. And before we move on to compare this projection to the year 2084, I want to review a few of the different tool features available in the Data Explorer. So the map is the initial way that the data is displayed, but you have the option to view the results in a chart or table form. So you're going to click on this highlighted icon that looks like a bar chart if you want to view the data in a chart form, and it'll appear like this. You want to click on this icon here, bolded in red, if you want to view data in a table format, like is shown here. And also, you can click on this About Data icon to learn more information about the data. The tracking network is very transparent about where all of their environmental and health data are from. And if you can click on this to learn more about the data set. If you click About Data icon, it brings you to this screen. And this tab, you can look at a variety of things, including how the data is collected, the limitations of the data set, as well as the other factors that are listed here. You also have the capability to export the images that you create. So you can export the maps or the tables that you create in the Explorer. And you also have the ability to export the data set by clicking on this icon. And this is important if you want to perform your own analysis. So all of the data is transparent and publicly available. So, but getting back to our scenario, we wanted to compare 2 different scenarios side by side. But I want to just draw your attention to these areas in the middle. These are to maximize either display window to see it in a full screen. And these small arrows are to copy the existing map and move to the right side of the screen. So you can move the maps or tables to either side using that feature. But we wanted to look at 2 different scenarios side by side to compare the results. And so we want to create a second map. So our data where we looked at 2021 data will stay here. And we're going to click the select data icon here to come up with another scenario that we can compare it to. So again, once you click that select data tab, the initial table comes up again, so you can do another search. And now we're going to we're going to pick the different scenario that we're interested in, and it'll create another map. So we're going to keep all the variables the same, except we're going to change the year to 2084. And now you can look at the, Now you can compare these 2 data sets side by side. So this is looking at, on the right, the extreme heat days predicted for 2021 and compare it to the future predictions. And the darker colors represent the greater number of days where the temperature reached over 90 degrees Fahrenheit. And you can see that more of the country is going to be affected by extreme temperatures. And that's important in public health planning, knowing where to direct resources and messaging and education. Healthcare providers and facilities have to have the resources and knowledge to treat heat-related illness more frequently, especially in areas that aren't used to having to deal with that issue as frequently. So now let's get into the tool together and walk through another example. And this next scenario is going to be focused on air pollution and asthma, other issues that are affected by climate change. So I'm going to pull up the Explorer and we can walk through this scenario together. So as I mentioned, they're both health and exposure data available in the tracker. So we're going to look at local data for ozone levels. So we'll look at state level data this time in New York State. And then we're going to compare it to asthma emergency department visits in the same year. So I'm going to get into the Data Explorer. There we go. So for this scenario, we said we're going to look at ozone levels first. So for the content area, we're going to pick air quality. And the specific indicator, we're interested in ozone. So we're going to pick days above regulatory standard using both monitor and model data. So there can't be an air pollution monitor on every block. So estimates through mathematical modeling need to be made to estimate the areas of pollution in the areas that don't have the monitors. And the measure, we're going to select this first one, number of days with maximum 8-hour average ozone concentrations above the air quality standards. And I mentioned we're going to now look at state level data. So you can look at it for national level data, but we're going to look at state. And we're interested in New York State. So we're going to further choose that for geography. And the latest data that are available is 2016. So we'll choose that. There are no advanced options available for this variable. So we're just going to click go, and that'll create our map. So now we can see where the highest levels of ozone are, and not surprisingly, it's where we are in New York City, where there's a lot of traffic. But now we want to compare this to a health variable. So now we're going to click select data on the other side of the screen to create a second map. So we had said with the scenario, we're going to look at ED visits for asthma. So the content area is asthma. Then the specific indicator, we're looking at emergency department visits for asthma to look at exacerbations. Just for the sake of this example, we're just going to look at number of emergency visits. And again, we're looking at state level data. So we're going to pick state. We're interested in New York. We could also compare different states side by side. And again, just to make it comparable to the ozone data, we'll pick 2016. And there are no advanced options available here, so we'll click go. So now we're able to look at exposure and health data side by side. Asthma is a multifactorial disease. There's many different environmental exposures that are associated with exacerbations. And surveillance data is not designed to prove causality, but you can look at associations that can be further explored with research. So I would encourage you to take time on your own to look at the Data Explorer, look at other environmental and health variables that you're interested in as well. But now I'm going to hand it over to Grant to look at the local environment and health data portal. Oh, you're on mute. There we go.
Sorry, I keep doing that. I don't know. It's like I have a thing. I apologize, everyone. Let me just share this. All right. So thanks so much. Yes, so we are the CDC's designated partner in the Environmental Public Health Tracking Program for New York City. And we, as part of our grant requirements, several years ago, developed the first iteration of the Environment and Health Data Portal. I'm going to take a moment right now to just ask everyone to please go ahead and navigate in your browser to this URL. It's just nyc.gov/health/environment data, which is where you'll find our portal. I have an image of it up here, and I'm going to walk you through some of our functionality. I'm going to focus on climate for obvious reasons, but we have a lot of data. I'll talk about that with you. Would you be able to share that in the chat as well? Carla? Oh, okay, Lauren's already
Done, yep.
You're the best. All right, wonderful. So go ahead and click there so that you can see what I'm talking about. So, we are the tracking program for New York City, and so I'm hearing an echo of myself. I'll push through. So we try and present the data that the health department and other agencies throughout the city have pulled together. We do that in 3 different ways right now. We offer these 3 products. One is the Data Explorer, which actually just walks you through different data sets. We also present the data from a neighborhood perspective. So that means that we are allowing you to choose neighborhoods within the city and get an overview in particular subject areas of what the data shows for that neighborhood and how it compares to other areas of the city. Finally, we've started taking a more journalistic tack as well and doing deeper dives into specific issues in environmental public health within the city with reference to the data. And so we look at environmental injury, we look at heat, we look at all kinds of air quality issues, and we present them in more of a storytelling format focused around the data that we have on the portal. So that's what we offer, those 3 different things. We publish data, and there's a lot of it. There's over 250 different indicators. We publish data on exposures, and we cover things like air quality, as I mentioned, housing conditions, food safety, which is something, of course, that we regulate at the health department within New York City. We talk about air quality of inside as well, so internal air quality like carbon monoxide incidents and that kind of thing. So and this is just to scratch the surface of our exposure data. We also publish data on health outcomes. So asthma, cancer, lead levels. We do lead inspections and lead testing for the city as well. So we have a lot of data coming out of our department that encompasses a wide range of different health outcomes. So we also present the data sources so that you know where the data is coming from and you know that it is been reliably sourced and checked. We have an extensive QA/QC process before we get these indicators up on the portal, so you know you have confidence in the data. We spend a lot of time on this part, and I work with a very small team, but we have partners in a variety of different areas of the agency that help us pull data in their specific areas and bring that data in. So, we are a small team, but we don't have to do all the work. We have more of a federated approach and allow other folks to highlight their data on our portal. It makes it easier for them also to get it out to the public. So I talked a little bit about data sources. I think it's interesting to appreciate that we're not only featuring health department data, although we do have that. So we generate data ourselves. We have a partnership with Queens College, as you've heard about, the New York City Community Air Survey. That data is available on the portal. We also present environmental aspects of survey data that comes from the Community Health Survey, which is, again, DOHMH data. Blood lead data from our Healthy Homes program right here in environmental health. But we also present data from the state. And that means that we have alcohol access data for different neighborhoods. We also bring in data on a variety of other kinds of exposures and environmental variables from other data sources within the city, other city agencies, as well. So we're trying to be sort of a central repository for environmental health data so that you don't have to try and discover things in different places. You can come to us at least to get neighborhood level data for the city. All right. We're also very interested in improving the options and tools that we have available. So I think right now, what we're going to do is just walk through some of what is available on the portal. And again, I'm going to focus on climate change, but I want you to keep in mind that we are here to meet your needs. And so I'm going to be or moving into a discussion after this about how this kind of tool might be used in your workflows. And I'm very interested in hearing how we might be able to improve the offering to better meet your needs. So if you can think about, as you're going through these tools, how you might be using them in your own workflows, and what additional tools, data you might be interested in accessing, that would be great. Again, we're always looking to improve the offering, and we don't get enough opportunities to actually work with the people that are using our site. So love to hear about it. And I also know Patrick, who's in charge of the federal portal, and we talk monthly at least. So I'd love to share your feedback on the federal portal with him as well. So anyway, let's get into the portal a little bit and look at it. I'm going to switch to a web browser. So here's our portal. Again, the Data Explorer, Neighborhood Reports, Data Stories. If you scroll down, you can also see we have a Climate and Health Hub where we bring together a bunch of climate information, and I'm going to dive into that a little bit later. We have an Air Quality Hub where you get a lot of ICAS information. Again, that's the New York City Community Air Survey. We have all our data stories listed here as well, so you can see kind of some of the newest stuff. We have a new street safety focused article in here as well. And then we also have some teaching resources. So folks who are interested in using the portal in their curriculum, we have middle school and high school based curricula here, which allows you to teach STEM skills by using the charts, tables, and graphs that we have available on the portal with environmental data. And you can also just download data directly. If you're looking just to download data for your own research, you can customize your own data set with from our database and pull it in CSV files and so on. So that's all available there. All right, so that's sort of the overall overview. I'm just going to dive into the Data Explorer because this is sort of the core of the portal. So if you guys want to follow along with me, that would be great. Here is again, outdoor air and weather is our first topic, but we've tried to organize them into intuitive different areas. But I'm going to focus again on climate, so let's go ahead and dive in there. The climate subtopic page brings up all of our indicators here on the top, and there's a bunch of information down here from the health department just sort of talking about climate and weather, its relationship to health, and what our data looks like, as well as what you can do. So that's a bunch of great information, but let's dive into the data again. So we have a variety of different indicators here. I'm going to start by talking about heat vulnerability. We have our heat vulnerability index by neighborhood tabulation area. So you can see we offer it first in a table format, but we also have maps available. The map allows you to see in pretty good detail, neighborhood by neighborhood, what the vulnerability looks like. This is the same map with a different color scheme that you saw earlier when Lauren was presenting. So this is just a description of the data up here. We also have information about how this specific indicator was calculated, and we talk about some of the things to watch out for. We also have links in here to go look at this indicator in more depth, and we talk about the source of the data. So this particular indicator is a score, and it's coming from ACS, it's coming from Parks and Recreation data, Geological Survey, Landsat information, and Census Housing and Vacancy Survey info. So this is a combined indicator. But we try to provide as much information as possible so you know what you're looking at and what it's all based on. So that's one indicator. I already pulled up some other indicators, so I'll switch to those as well. Yeah, so we have households reporting air conditioning here. This is when folks wonder why the health department talks about air conditioning so much when we're talking about heat illness. I think one of the things that we're looking at is this particular calculation, which is coming out of the New York City Housing and Vacancy Survey. When people see what it looks like for households reporting air conditioning, the map is familiar, right? So a lot of low-income areas in central Brooklyn and the South Bronx, northern Manhattan, are where you'll see there isn't as much air conditioning. And air conditioning obviously is a great intervention. If folks have air conditioning, they don't have to worry so much about being indoors in high heat situations. Seems unusual to be talking about this in the middle of winter, but this is one of the main issues with climate change, of course. So we also have this scatter plot here as part of our offering, which shows this ecological relationship between households reporting air conditioning and heat stress emergency department visits, which is another one of our climate-related variables. So you can see that as you have more or higher percentage by neighborhood of air conditioning, the number of emergency department visits is directly related. Now, this isn't the only thing going on here. Obviously, these two variables are only part of the story, but this is definitely one of the things that factors into our thinking about why pushing air conditioning as an intervention is super important. All right, so let's swing back. For those of us who are, or those of you who are following along, I'd like to highlight the Climate and Health Hub as well. So this is where we've brought together some of our core information about climate change and how it's related to health. So we have some interesting things here. So we have the Heat Vulnerability Index, which we talked about earlier. We showed earlier, but this allows you to actually pick a specific neighborhood. The default is the health department's address here. So I'm going to go ahead and click here. But if you live in New York, go ahead and put in your own address and click here to get data. And then you'll see that it actually highlights that neighborhood that you chose and shows you also all the other neighborhoods and how they compare. So you can also see the breakdown for the different things that are affecting heat vulnerability and that have been included in this scoring. So green space, temperature, air conditioning, and poverty are all part of the calculation. We also talk about racial disparities. So there's a lot of great and super important information in here. So I encourage you to take a look. I also encourage you to let us know what you think about all this stuff. And just to get you in a little bit more to looking at the data, why don't we do a quick activity? Oops, that didn't work. If you don't mind, go ahead and go into the Data Explorer and see if you can find under health outcomes some of our data on weather-related illness and explore that a little bit. And meanwhile, if anybody has any ideas for how the site can help you in your work and how it might be improved to better meet your needs, I'd love to start that discussion as well. Thanks.
Thank you, Grant. Does anyone have any questions, thoughts, suggestions? There's been some ideas going back and forth in the chat, but we wanted to leave time to open the floor, questions, feedback, how you've used this type of data in your work.
Joel, you have a question or an idea? Go ahead.
I'm very happy that all this data is going up. I'm head of a group called Environmental Justice Initiative, and we've tried to bring actions against polluters and other people out there. The trouble is that the air monitors that the city uses is giving us a neighborhood grid, telling us how bad the neighborhood is.
Mm-hmm.
Every polluter that we've gone after, a bad contractor or a bad landlord, they use that data to say the neighborhood is bad, okay? And we're not causing anything, it's just incremental. By law, and it's allocated that the city health department can mobilize those monitors around the site to do triage, would give us data so we could go after those people. The buildings department and other people can go after that. But the city health department has been reluctant to do that. I hate to be the critic, but that's the role that we play. So it's really important to look how this is being, could be used. And also it could be used by the buildings department and others to enforce it. So right now there's just, complaints go unheeded at 311. So I think that's really important to talk about how we could do it. And just one more point I want to monopolize is that any of the clinicians here that are on, if we get a letter from a client, okay, saying that the problem at that smokestack or the demolition site is aggravating someone's condition, I think we could use that as a tool to push, even if the health department goes along with that, or the health department, the buildings department, they have less discretion and they could use that for enforcement. So just a simple letter from anyone that's listening to this could really change what's going on. And Mount Sinai has helped us in the past at their occupational environmental clinic.
That's great. I'm glad that a letter from someone who should be able to diagnose is such a help. I wish I could speak more for our air quality program to know a little bit better what we could do in terms of enforcement. That's not my role, unfortunately. But I know that resource-wise, I think that's probably a challenge. So it's true that our current monitors are not set up to do enforcement style measurements, right? So our current NICAS monitors are measuring 2-week windows, right, of exposure. And so we put up a monitor, it sits there and sucks in air for 2 weeks, and then it gets pulled down, and then the different elements of the monitor go in for analysis, and then that information gets put into our data pipeline, right? But it's very hard for an acute exposure, right, for a big surge of smoke or something like that, for that to be detected in that situation. These monitors were not designed for that.
But you went through all the information about everyone who's using their phone. So I just want to say there's the technology is out there already. Yep. And the city and the state has that stuff already. So absolutely. All right. And I think that's so. And I just got to say, and I just want to be adamant, if people believe that things are being fixed by all this data that's coming out. So to me, it's also doing a disservice thinking that we're all helping everyone that's out there. All right. And now with the federal administration, there's plenty of people to do backup, including the EPA. Now we have a new EPA that just the city giving that information would, could really help. So
that totally makes sense. And I think that's absolutely right. I know that we do enforcement, in restaurants. I think it's actually DEP that's supposed to be doing air quality enforcement, honestly.
But they tell us, right.
Which is weird, because we're doing the monitoring, but they're doing the enforcement, right?
Right. But once you show that it's a health problem, it takes away a lot of their discretion not to act. All right. And now we're having problems that they're using COVID, the governor's executive orders, as a reason not to protect workers and people in the workplace. They're actually using that as a dodge for not doing enforcement. All right. So I think it's important that, that we got to exert pressure from all sides. So.
Absolutely agree. What do you think about the idea of actually pulling or putting data up on the portal that would highlight the enforcement problem? So one of the things that we've been experimenting with is actually we put up evictions related data. last year with the idea of it, highlighting some of the housing disparities that lead to health problems. Do you think that, do you know of actually a data source that would help show like that the fines are not being collected and that kind of thing?
Yes, well, one thing we cite all the time, as like a year ago, the city has $1.5 billion of uncollected fines from contractors and landlords. So,
Right.
So
yeah, that's crazy.
And the way we could stop it also is the city could stop giving leases and giving them more permits, and then and even putting people in those locations. So there's something called the bad actor policy, which the city has done. We use that when there was the bad West Nile virus spraying with the help of Mount Sinai to show that the workers are being hurt. We claim that the city shouldn't hire the bad people that did it, and they canceled an $80 million contract. So there are tools that are out there now, that we could use. The city just has to be more, more robust, and the people in every agency's got to push to show that there's a major health problem, especially in the age of COVID. So.
That makes sense. I mean, I'm happy to talk to folks around the agency around that, but I think that in order to do enforcement, we're going to have to, there's a lot of, there's a lot of things that are going to have to happen to, in terms of like which agencies are responsible for what, and I think to connect the dots as much as we can with the data is going to help push the city that direction. Again, I think, honestly, all of these data tools are policy tools, right? And if you can take the data and get the right data out there to show these connections, if you can show that, air quality may be bad in this neighborhood, but look, enforcement is not happening in this neighborhood also. Maybe there's a relationship, and be able to push the city council to A, budget for enforcement, and B, to ask for reporting on that enforcement, right? So that we have some ability to evaluate, the city's performance. I think that's the type of thing that can move this forward.
But I also just want to say the data can be used to fight bad new construction that's going on. With all this heat island effect, we brought up, and other environmental justice groups have brought up, fighting a permit for a building, going up, and the city law department says there's no impact on heat island, on the heat. So the city, especially with all this rezoning that's going on, this data's got to be used to stop ongoing construction. And there's people, I think the city law department are not reading, or definitely not on this call today. All right, so I think that's one area that we could really make a dent, is just to stop ongoing federally funded and city funded construction.
Right. Yeah, I think one of the problems in the policy realm, of course, is that the public health perspective is not out there, right? So folks are looking at individual cases and they're saying, "Oh, this is incremental. It's what's the big deal?" But the meaning of incremental is, it adds up, and we're looking at this sort of system-wide effects that are pushing mortality and so on. So, that's what needs to be talked about, right? Is not whether or not one particular polluter is, only contributing a small amount. It's like how all those small amounts add up to a very large amount.
Grant, we have a few other people who have their hand up, and there's more questions in the chat. And since we only have about 10 more minutes, we'll keep going. There was somebody that had their hand up, Ellen.
Yes, hi. Ellen Weiinger here. I'm Director of Educational Outreach at Grassroots Environmental Education. And thank you so much for this great seminar this afternoon. It's really been very enlightening and great resource. I just wanted to touch on something that ask about that you touched on just a moment ago with Joel, and just something about the spikes, and that the monitoring may not reflect, an extreme spike. And this overall seems to be a problem with the national ambient air quality standards to begin with, that these are averages over the course of, let's say, 8 hours, I think it is. And they wash out those spikes. And those extreme spikes are exactly when, we see these exacerbations of health effects, episodes with asthma and other respiratory problems, COPD, and all the other associated health effects. So I'm just wondering, rather than kind of skipping over that, how we can actually address that issue, and in particular with this data, since it is so critically important, because we may be seeing spikes, or there may be spikes that we're not actually looking at, that are occurring not just, let's say, once a week or a couple of times a week, but that they happen pretty consistently every day, and perhaps certain times of day, and that we should really
my name
be
is
looking at
Erin,
that.
and the title of my poster is Empowering Physicians to Discuss Climate Change with Patients Whose Health is Affected by It. More recently, patients are beginning to develop symptoms that are attributable to climate change.
Sorry, I'm not sure where that's coming. That wasn't a response to your question, Ellen, and that's a great point. And I know we're running out of time, but remember at the beginning of the presentation, I brought up the Rutgers and the truck counting and air pollution counting example. And I know that Lou Squell is also on the call. I don't know if she wants to jump in, but this is when community science could augment and leverage existing databases. So, and I will post this in the chat, but on the Rutgers program, like they posted the community generated data, and they saw those spikes in fine particulate matter and elemental carbon based on when the trucks were going by, and they were able to get that minute data. They would go the same time every day for so many weeks, and then after the ordinance, they collected that same data and saw the dramatic decline. So I think there's ways that we can use both these bigger data sets and community-led data collection to make a point and push policy and advocacy forward.
Right. And I so appreciate that response, but also I'm also wondering, on a larger scale, how do we advocate for better air quality standards in the first place? And those measurements for NACs that should be more reflective. And what are your thoughts on that? And that might be a separate discussion at another time, but if you can just touch on that point, so that these standards are are more meaningful and reflective of what they show and what they don't show.
Right. I think, yeah, I mean, I'd love to have someone else respond to that, but I think what I know about it is that the standards were reached with a lot of different factors sort of playing into that, right? But they are not complete, right? And we know that the picture that they paint is a different one than you would see with highly localized minute by minute kind of monitoring. But that doesn't mean that the standards don't have their place. It just may mean that what we need to do is do a bigger effort to focus on these sort of localized exposures and their specific relationship to health, and try and find a way we can bring government resources in to highlight and use these kinds of monitoring tools for enforcement.
Thank you.
Grant, I saw a question a few moments ago in the chat from Daniel, and the city recently started posting building energy grades similar to the restaurant hygiene grades. Will those data become available posted in these portals?
Building energy grades. Thank you. Would you mind if you have a link to that data set? I would love to add that as a sustainability data set to the New York City portal. So that would be great. I'm going to look for that. Is that something the buildings department puts out?
Daniel, do you know? I know I one day walked into my building and I saw the new flyer on the wall that says a bee. That's a fabulous idea. I will try to find an
Yeah,
example.
unfortunately, I don't know which agency posts them, but yeah, similar to you, I've walked by lots of buildings that have it. So,
all right. I mean, I can do the research to find out. That's part of my job. So, but I thank you for letting me know that it exists, and we'll do our best to pull that into a neighborhood level data set that folks can browse.
We have a couple more minutes. Any last thoughts, questions? This has been a great conversation.
I'm especially interested if anyone has any ideas for, you know, the way the tools work. Is this what's missing? You know, in terms of getting data for policy, like what else?
Grant, I really like how you have created in the portal the data stories. And what we found, our team, you know, what we find works well in advocacy are the numbers, but also the stories behind the numbers and people's experience, and using them both together.
Right. Yeah, that's great to hear. And that's exactly the reason why we started doing that, was because folks that we talked to really wanted context, and they wanted to be able to put the data into perspective, right? And how it's affecting people directly, and what the details are about what the data shows. So we have some of that knowledge here at the health department. So why not share it? I mean, that's exactly what we're trying to do. So thank you.
I also wanted to mention we have the resources that we discussed, and the web-based tool, the links to the web-based tool will be in the online syllabus. So I'd encourage everyone to kind of explore these tools on your own and see how they may be useful for your own work and interests.
Yeah, feel free to reach out. We'd love to hear from you if you have ideas down the road too. We're trying to get folks involved and have a regular feedback loop with you, our users. So thank you.